Thank you for watching the new patient orientation for Pomeroy Chiropractic Wellness. I'm Dr. Sean Pomeroy. I just want to thank you for watching the video, taking your time to do it. What we'll talk about is a chiropractic, obviously, but we want to talk about the science of chiropractic, how it works, why it works, is there research behind chiropractic, the benefits of chiropractic for people that have no symptoms. And so the purpose of the talk is just for people to get a better understanding of chiropractic. Some of the comments I hear quite a bit from people is that they say that they believe in chiropractic, and sometimes people say, I don't believe in chiropractic. As far as I'm concerned, chiropractic's not a religion, it is a science. And so the science of chiropractic is what I want people to understand, and so that's the purpose of this video. So the first question that I ask people is, what controls and coordinates all the functions in the human body? And of course, it's an easy answer, it's the brain. The brain sends out information to all the different body parts, and the body sends information back up to your brain. So that two-way communication is what allows your body to function. And so when we talk about that life flows from your brain down through the spinal cord, through the spinal nerves, to every cell in your body. And the research says that there's 70 trillion cells in the body, so that communication is important. So the sole purpose of chiropractic is simply to remove the interference between the brain and the body, which allows the body to function at 100%. And so when people talk about, chiropractics for back pain or chiropractics for neck pain, I heard it was good for this, it was good for that. I try to remind patients that chiropractic doesn't cure anything, doesn't fix anything. The sole purpose of chiropractic, like I just said a minute ago, is simply to remove the interference between the brain and the body. That way the brain and the body can function at 100%. Let's take a look at the spine, and I'll explain to you how all the different parts of your spine and how your spine works. So this is obviously your spine. The bumps back here, that's the back of your spine, which would make this the front of your spine. So the bumps back here, that's what you can reach back there and feel. That's what sticks out there. So with your spine, we have three sections or regions of your spine. We have the neck, or the cervical bones. We have the thoracic, or the mid-back bones. And then we have the lumbar vertebra, which are the bottom of your spine there. We also have a hip bone, a tailbone, and a hip bone. And that's how your hips walk, is that your hips kind of glide back and forth like that. So your spine basically sits on top of those three bones there. This shows what the back of your skull would look like. So your head obviously sits right here. So the brain sits inside of your skull here, and then the extension of your brain is what's called the spinal cord. And the spinal cord, you can see the yellow part through here. The spinal cord runs all the way down through your spine there. You can also see it a little bit down in there, the yellow part there. And so the communication starts in the brain, comes down the spinal cord, and then exits through what are called nerve roots. There's a left nerve root and a right nerve root, and those nerve roots exit between each and every vertebra. So that's what these yellow parts here is what's called nerve roots. Now nerve roots, like I said, carry the message from the brain through the spinal cord, then out through the nerve roots, out to different body parts. Now once you get about that far out from that nerve root, that's when the nerve will kind of separate into the nerves that go to the skin, the ones to the muscles, the ones that go to the organs, glands, tissues, blood flow, all those different body parts there. But at least at that moment, it's all one nerve. The little white clear sections here are what's called disc. Discs are just purely cartilage and fluid in there. And then one of the first jobs of the disc is that it provides cushion between the two bones there. And so if those bones are crunching on each other, that it's not going to feel very well. We don't want bone on bone. So the disc partly acts just as cushion for your spine. Also, the disc provides space so that the nerve roots have room to exit your spine there. And if that disc wasn't there, then that opening for the nerve root would get much smaller. So if you look on this model here, you can see the opening is nice and big for that nerve. So as you bend and twist and move around, there's plenty of room for that nerve root. As that disc thins out, you can see here there's very little disc there, so the opening becomes much smaller for that nerve root. So that's part of the purpose of the disc as well. Now the disc, if the discs get too thin, then you can see the progression here. The disc gets thinner and thinner, and that's the beginning of degenerative joint disease, osteoarthritis, arthritis, whatever name you want to call it there. But that's part of that degenerative process as the discs get thinner and thinner. You can see also the bone start to change shape and things like that as well. The disc, we want it to be just the right size. Disc is too thin, looks like this. The disc gets too big, it leads to what's called a bulging disc, or protrusion is the new word. Herniated disc would be another thing that goes with that. And when that disc swells up, it'll push on the nerve root there. And so that pressure on the nerve root is what can cause the nerve interference between the brain and the body. So typically, if it's a bulging disc in the lower back, sometimes patients will have tingling or numbness radiating down into the leg there. If it's a bulging disc in the neck, then usually sometimes patients will have neck symptoms that go with that. You'll also see a little artery here. This artery feeds the back part of your brain. The back part of your brain is where your eyesight comes from. So sometimes if you ever heard of a patient who has a severe headache, even a migraine, and they have light sensitivity, just trouble with how bright things are, part of that is that the blood supply is cut off, as well as the nerve supply that contributes to the headache and then also to the light sensitivity. So as far as your spine goes, there's 24 vertebrae total, and so when we palpate your spine, that's what we're looking for as far as the nerve interference. So when the spine is misaligned, it's called a vertebral subluxation. Now, most people have never even heard of words like that, but vertebral just refers to the 24 bones of your spine there. And then subluxation is the word that no one's usually ever heard of, and that's the one word to me, though, that's most important as far as our profession, because when we palpate your spine, if that bone is misaligned, it's called a subluxation. The purpose of adjusting a patient is to correct a subluxation. So a subluxation, the definition of a subluxation is sub means less than or below, lux means light or life, and then ation is the condition of. So when your spine misaligns or it subluxates, then usually it'll twist one way or it'll twist the other way. So I'm going to show you using my thumb here. If I subluxate this vertebra, I'm going to push it over to the side there. So I'll put my thumb in between there. So you can see these are in a nice smooth line, so those are all in the proper position, whereas this vertebra is over toward the side. It's rotated this direction here. So what happens is on this side, you can see that nerve root. This is the subluxated bone. So you can see that nerve root, there's plenty of room, but when we look at the other side, same two bones there, that opening becomes much smaller. And so that's where the nerve interference comes in with the subluxation. So when the bone is twisted to the side like that, there's where the nerve interference comes in. So when we do what's called an adjustment, we're trying to correct the misalignment. So we'll just rotate that bone back across. Now the spine can move properly again, and that's what a subluxation would look like on your spine. So if you're laying down, like I said, these bones would be in nice, smooth shape there, except for the one that's subluxated there, so I'll push it this way. So that bone is subluxated there, so this one will stick up higher than the one above it and below it. This side will be up higher, this side's down lower, so I know that the bone is rotated this direction. So adjustment-wise, I'm going to push here to correct that misalignment to where now it moves again. So a subluxation, I'll show you a picture of what a subluxation would look like. So you can see on the normal side here, on the left side, you can see how the bones are in a nice smooth line there. The nerve roots are yellow, nice and happy and healthy nerves there. The disc look normal, things like that. The alignment is good. You look at the subluxated side in the picture, you'll notice that the first thing is that bone slid backwards. So that bone's pushing backwards and the spinal cord runs down through your spine. So that backwards direction there puts pressure on the spinal cord. It also is going to interfere with the nerve roots. You can see the nerve roots there are pictured in red. The disc, because of the misalignment of the bones, the disc also has pressure put on it as well. So that misalignment, once again, is called a subluxation, and the sole purpose of chiropractic is to detect and correct subluxation. That's why we adjust people. So when that misalignment interferes with that communication between the brain and the body, then your health is affected, your body's level of function is going to be less. So sometimes patients will tell me, you fixed my headaches, or you cured this, you fixed that. And I always remind patients that the body does all the work. When you cut your finger and you put a Band-Aid on it to protect it, the Band-Aid doesn't heal your finger. The finger has the capability to heal itself through the brain's information there. So chiropractic is the same way. We don't try to claim that we cure this or fix that. We're simply here just to make your body work a little bit better, give you a push in the right direction. So on the nerve chart, you can see all the nerves and all the different body parts that they connect to. And so what we're going to talk about is T6 vertebra. Now the T6 vertebra is right about here, only it's on the back side. So it'd be right between the shoulder blades. Now the T6 vertebra, its main nerve supply would be stomach, liver, gallbladder, things that are in that region of your body. Are put together pretty well. So nerve-wise, things kind of match up. Your stomach nerves would be about here because that's where your stomach is. The kidney nerves are about here because that's about where the kidneys are. Your sinus nerves are going to be clear up here in the neck. So I'm going to show you an analogy of what would happen with the subluxation. And I'm going to use the light bulb to help demonstrate what's going to happen here. So the light bulb is going to represent your stomach. So in this analogy, we're going to talk about the T6 vertebra being subluxated. Now your T6 vertebra sits right between the shoulder blades, about this level, give or take. And the T6 vertebra, nerve-wise, is going to make the stomach work, liver, gallbladder, things that are in that region. And our bodies are organized very well. And so the nerves for your sinuses are going to be high in the neck, same with ears, nose, all those kinds of things. Heart and lung nerves are going to be higher in your section there because that's where those organs sit. The kidney nerves are a T9, T10-ish. That's about where the kidneys are. So the nerve-wise, things are pretty organized with your spine. For the analogy, the light bulb will represent your stomach. And so the power from the wall would be the brain, and then the cord running from the wall up into the light bulb is going to represent the nerves. And so if the brain can communicate 100% to the stomach, then the light bulb will be nice and bright. If the communication is not as good, then the light bulb gets dimmer and dimmer. So for the analogy, this is what we'll use is for the stomach. So the stomach, if it was 10% subluxated, that would mean that there's 90% function, so the light bulb might get just a little bit dimmer, not much difference. The body's is built for survival, so the light bulb might get a little bit less, but the body still can manage things really well. Okay, for 20% subluxation, light bulb gets just a little dimmer, but we still have 80% function of the human body, and so it's going to try to get by the best it can. We jump up to 30%, now we have belching, and this is belching that, and then usually we try to blame it on something. Oh, I drank a Coke and it made me belch, or blah, blah, those kinds of things. But what this is trying to show is that the nerve interference can cause the belching, and so that's what we're looking for here. Jump up to 40%, now we've got bloating. I call it the Thanksgiving meal feeling, where you just feel like the food just sits there and you're just all bloated and uncomfortable. So 40% subluxated, now we're down to 60% function, and so we're starting to see the progression here. So you may have medical diagnosis for other health issues, but for chiropractic, our approach is the same. We're simply trying to detect and correct subluxation. By doing that, then we improve your health. And so chiropractic doesn't treat pain, doesn't treat disease. Our goal is just to make your body become healthy. And obviously that's not something that happens overnight, but if we can start the progression of being healthier, that's what we're after. When your body becomes healthy, then it takes over, it knows what to do. So that's why those healthy choices become important, because when you supply the body with the right information, you supply it with the right food, all those kinds of things, then your health will get better from there. How do we find a subluxation? I was showing you earlier with the spine there, but for the number one way to find a subluxation is simply to palpate it, feel for it. So when we palpate on your back, that's what I'm feeling for, is the subluxation. The second way that we look for subluxation is decreased range of motion. So if I can look to the right 90 degrees, that's considered normal. But to the left, I stop about here. That could be a sign of a subluxation. So if I can look right, 90 degrees, but left, I can only go about 30 degrees. That could be a sign that the spine is subluxated. The third way would be a change in your posture. So if my shoulder is here and this one's clear down here, that could be a sign of a subluxation. Same with hips. Sometimes hips, people look crooked when they stand. Part of that could be just a sign of a subluxation. The last way would be x-ray. We don't x-ray at our office for subluxation. We refer out if we ever need to do that. Thankfully, it's not very often, but at least on the x-ray at that moment, you can see a subluxation. So you can palpate for it, loss of range of motion, and posture change are the three main ways that we look for subluxation. Question is, can we help you? If we detect a subluxation through palpation, loss of range of motion, abnormal posture, then yes, definitely. Chiropractic would be a great choice for you. Whether you get well depends on your body's ability to heal. And so I tease patients, if you smoke a pack of cigarettes every day, you eat fast food 3 times a day, and you never drink any water, then how fast you heal is going to be slower than someone who gets some exercise, eats right, makes good food choices, drinks lots of water. That patient, of course, is going to heal a little bit faster. What causes a subluxation? The easy answer, of course, is stress. Stress challenges the body's ability to adapt to its environment. So when your stress level is higher than what your body can adapt to, then it can impact your health. For us, sometimes that means back pain. Sometimes it could be neck pain. Sometimes people get under stress and their digestion gets a little goofy. So it's different things for different people, but when your stress level is higher than what you can adapt to, that's how it affects your health. So getting rid of your stress is not practical for most people. Stress for most people remains pretty constant. You might have a bad day or death in the family or something along those lines, but for the most part, your stress level is pretty constant. So for us, the focus isn't on getting rid of all your stress. Our focus is on what can we do to make your body function better. There's 3 types of stress: mental, physical, and emotional. Mental stress. You can see from the picture the mom's like, with the mental stress there. And so something that a lot of people have that they would find stressful would be to give a speech. If I had to get up in front of 100 people and give a speech, some people, their palms get a little sweaty. Sometimes your heart rate would increase. That's just a sign of mental stress on a person. The shoulders might get tight and tense, things like that. According to the National Institute of Mental Health, 18% of the population has an anxiety disorder. This makes us the most anxious nation in the world. So as far as mental stress goes, if you want to look at the research, definitely there's a lot of mental stress going on in our society. The average high school kid today has the same level of anxiety as the average psychiatric patient in the early 1950s. Now this is from Robert Leahy, a psychologist who made that quote, but once again points back to the level of mental stress that most of us are under. Physical stress. The first thing that I asked patients was, as far as learning about physical stress, was, were you born? The birth process can be one of the most traumatic things that a person can go through. Even a normal delivery can be stressful on the baby, obviously stressful on the mom. There can be acute physical stress. That could be a trip and fell, some sort of accident, injury, sports injury from once upon a time. Then there's also what's called cumulative physical stress, and that's what gets most people in trouble these days. It's because they sit at a computer all day long and they, mouse, keyboard all day long, staring at that computer. That would be an example of cumulative stress. Another example would be, you climb up and down a ladder and you're reaching with the paintbrush. That would be cumulative physical stress on the body. The study from the American Journal of Neuroradiology, April 2015, it reviewed 33 different articles, had well over 3,000 people, and all of these people had no back pain, no symptoms related to the back. So otherwise healthy people. The results that they found, they took x-rays of these patients. And what they found was that 37% of 20-year-olds had disc degeneration with no symptoms. And so our society is very pain, symptom-based, and so Chiropractic-wise, we want to make sure that we check your spine to make sure that it's healthy. And so the research points out that 37% of 20-year-olds already are having changes in their spine. For 80-year-olds, it's 96%. Now, if you look at the picture, you notice that the degeneration is only at a couple of vertebrae towards the bottom, but the degeneration isn't all the way through their spine. So sometimes people think, well, just because they're getting older, their spine's automatically going to have degeneration in it. And that's not the way it works. It doesn't work in every single joint as far as getting arthritis, degeneration in there. So the point of all this is that you can have disc degeneration, your spine cannot be moving properly, the nerves cannot be functioning properly, and you can have no symptoms associated with that physical stress. Chemical stress, one of the broadest categories because there's so many things that can fall under chemical stress. Anything that goes on your body, anything you smell, anything that goes in your mouth, food, drinks, other things like that. So what the study looks at it looked at umbilical cord blood collected right after birth from infants. So this was done back in 2005. So what they found in this cord blood was they found 287 chemicals in the blood. They found 180 of those chemicals have been shown to cause cancer in humans or animals. 217 are toxic to the brain and nerve system, and 208 of those chemicals have been shown to cause birth defects or at least abnormal development in animals. This is a great example of chemical stress that most people would never even think of, but it's the mother passing on this chemical stress down to the infant. And one of the most important times to develop the brain and the nerve system and just the body in general happens in that 9 months. And so this is trying to show that chemical stress is there from the very beginning of life. This study they did a follow-up study in 2009 and pretty much had the similar results from it. The most important part when we talk about stress is not so much what type of stress each patient has when they come in the door. We want to focus on trying to raise their body's level of what they can adapt to. So if your stress level is here, but your body can only level of function is here, then stress is going to win. And we don't want that because stress will affect your health. So for us, like I said, stress level is pretty constant. So if we can bump up what your body's level of function is, if we can get the level of function above that stress level, then now your body can handle that stress and life is good. So for us, as chiropractors, detecting and correcting subluxation will increase your body's ability to adapt to any of that stress. So how does stress specifically cause a subluxation? You can see the picture up there, and so I'm looking at the upper left here. You can see that stress is in the upper left corner there, and when stress affects the muscles of the back back muscles have to attach to your spine, and so when those muscles start getting stress put on them, then the muscles start tightening up, and then they get a little sore maybe, and then maybe they even get into a muscle spasm. But those muscles attached to the vertebra, the muscles pull that bone out of place. That's what the subluxation is. And so that's how stress can cause the muscles to not work properly, pulls the bone out of place. There's your subluxation. Now sometimes the subluxation will put more stress on the body and cause more subluxations. So the easy example is my hip is subluxated to begin with, so I kind of walk goofy for a few days. Then now my knee starts to hurt. Now my low back hurts on the other side because of this initial subluxation. So that's where the circle kind of repeats itself there. If a subluxation continues from 7 to 10 days, according to research, if that subluxation continues, then it leads to what's called dysfunction. And that's when your body just doesn't function at 100%. So that would be, a lack of range of motion like we talked about earlier. It could be just sore muscles. It could be anything along those lines there. The body just doesn't function very well. You're not sleeping well, you're not eating well, those kinds of things. Energy level is less. When the dysfunction continues, it leads to dis-ease, and that's when we start to put a name to it. We give it a diagnosis. That would be, lumbago, which would be low back pain, or it could be cervical disc radiculopathy, which would be nerve symptoms down the arm, starting in the neck, say. So for us, the key thing that we really want to focus on is that we want to focus on the prevention side of healthcare. And so prevention is more on the upper right as far as the stress, muscle spasms, and the subluxation. So if we can prevent those types of things, then we don't have to worry about the rest of the circle there, which would be the dysfunction and the dis-ease, because that's more of a treatment-based type of thing. And then that's where you're trying to correct something after the fact. And so prevention for us is the key as far as healthcare goes. And so we want to slow down that wheel as much as possible. We're not going to live forever. So that wheel's going to go, the hamster wheel's going to go round and round. So if we can adjust you, if we can focus on eating better, maybe getting some exercise, decreasing the mental stress, whatever the case may be, then those would be prevention type of things, versus if we have to wait till the problems really become an issue, then it's more of a reactive type of healthcare. So in this study, what they were studying was the immobilization. And so what they did was they would take a rubber band and they would place it around the knee joint of a rabbit. And so after 1 day of immobilization, the knee joint can't move properly because of the rubber band. They took the rubber band off, looked inside the knee joint, and the knee joint was just fine. It was healthy as can be. On day 2 of immobilization, 2 days of it being wrapped up, opened up the knee joint and things were fine. It wasn't until after the 3rd day that they started to see changes in the joint. And then after 7 days of immobilization, they also started to see changes as well. So on day 3, they saw increased formation of collagen. And on day 7, they saw increased glycosiminology, which would be protein type stuff that's in the joint capsule. So within 3 to 7 days of immobilization, the studies show that there was already changes within the joint. After 2 weeks of immobilization, there were the first signs of eburnation in the subchondral bone, which is exposure, wearing, and hardening of the bone because of the extended fragmentation of the protective layers of the cartilage in the spine. Basically, that's a big fancy sentence to say that the bone was starting to make changes in the bone, and then also the cartilage itself was starting to get fragile, decay, whatever type of word you want to call it. So basically what happened from that study is that they realized that immobilization is bad and mobilization is good. So this, as far as knee surgery goes, completely changed how healthcare was done, because before 1987, if you had your knee replaced, it was a very slow process. Rehab was very slow to start. You were stuck in bed for a week, those types of things. After that, they realized nowadays when someone gets their knee replaced, they're already up the first day, trying to be weight bearing on that new knee. So it's completely changed not only the surgery itself, but also with how fast the rehab starts. Chiropractic-wise, before 1987, if you had a bad low back issue, we might have told you, bed rest was your best bet. We gotta let things calm down, take it easy, not much movement. And obviously nowadays we want to try to adjust you as fast as we can because we realize the importance of the joint moving properly. So the study basically showed that after 7 to 14 days of immobilization, you could see arthritis forming in the joint. A lot of those changes in the joint are permanent. Once the bony change starts to happen, it's hard for those things to go away. And so Dr. Veman was quoted as saying, "It shows beyond a reasonable doubt that immobilization is not only a cause of osteoarthritis, but that it actually delays healing." So when we talk about checking your spine once a week, we want to make sure that just those bones can move properly so that we can potentially avoid any arthritis starting. So we spent a lot of time so far talking about the structure of your spine. We talked about the nerves and the different body parts that they go to and the health of your spine. So now we're going to talk about the brain. Chiropractic and the brain is all, research-wise, is all within the last 5-10 years that this is really taking off. 90% of the stimulation and nutrition to the brain is generated by movement of the spine. This is from a Nobel Prize winner. And so basically everyone knows that sitting's bad, and we've heard it all on the news and in newspapers and magazines. So everyone knows that this concept that sitting, that we sit way too much in our current society. The quote says, "Sitting to the spine is like sugar to the teeth." So we want to find ways to keep you moving. And chiropractic-wise, we want to make sure that your spine can move properly. So once again, the brain and the nerves can communicate back and forth. So another example of chiropractic and how it can impact the brain is the Ogura study from 2011. This study was investigating the effects of neck chiropractic adjustment on the metabolic activity of the brain. The way that they measure metabolic activity in the brain would be with a PET scan. And so the study was looking at comparing the no adjustment group versus the adjustment group. And so the first group, they would palpate, poke around, move them around a little bit, but no adjustment. The second group would get that same type of thing, but then they would actually get the adjustment. So the comparative results from the study that were statistically significant was a lower stress level, better quality of life, significantly lower pain scale, decreased cervical muscle tone, so muscles in the neck were more relaxed. And then the last thing was decreased salivary amylase. Salivary amylase increases when you're under stress and decreases when you're under less stress. And so that's a significant marker in the brain as far as the stress level was reduced with the adjustment. So basically the subluxation can cause, we call it a brain problem. The brain just isn't functioning properly, and some people call that brain fog, or they say, I just can't focus, I can't concentrate. Those kinds of things would be sometimes how people notice it. But there's messages that go up into the brain that can get interfered with the subluxation, and then the brain can send information out to the body, and sometimes that can get interfered with as well. And so what happens is when that brain and the body can't communicate properly is we just have a decreased ability to adapt to our environment. So going back to the stress thing, we want to make sure that your body functions at as high a level as possible so that it can adapt to your environment. So chiropractic for the brain. This quote says it is likely that joint complex dysfunction, or what chiropractors would call subluxation, develops before pain is generated. This study was done clear back in 1997. It talks about how the joint can be misaligned before the pain is generated. The next one, a little bit longer quote here, but it says, while the brain can process several trillion bits of information per second, it appears that we are perhaps only consciously aware of 50 bits of information per second at any given time. This came from a study back in 2000. So one of the big things that patients get confused on is that if my back doesn't hurt, why would I get adjusted? And what these two studies point out is that your joints can be subluxated. They can be not healthy, not moving, not functioning properly, and you may not have any pain with that. And so the bottom part of the slide talks about that only 50 bits of that 3 trillion are even going to recognize pain. And so that's where pain can get people in trouble, because they think if I'm not in any pain, then I must be pretty healthy. So from the joint standpoint, these two studies prove that pain isn't a great indicator of how healthy your spine is. What about kids in chiropractic? Chiropractic for us is checking the spine as soon as we can so that we can find that subluxation. If we do find a subluxation, then we're going to adjust them so they don't develop chronic subluxations. And so one of the ways that a kid could have a chronic subluxation could be from the birth process. It could be rolling off the bed when they were an infant. It could be a bike wreck, jumping out of a tree, who knows what, sports injuries, all those kinds of things. We just want to make sure that the kids grow up healthy so that they don't have a chronic subluxation. And when they get in their 20s, 30s, 40s, they're not going, why is my low back, why does it look so unhealthy? Why am I having so many issues? Part of that could have been clear back from earlier in life with an old injury that could have been corrected with a simple adjustment when they were a child. The quotes from Arthur Janov, a PhD pathologist from Boston University, and his quote says, "The real cause of our demise is not diseases, but the spinal stress that happens at birth. This robs us of our innate potential for a very long, healthy, and happy life. A child will have less than optimal physical, mental, and social well-being." One of the concerns that a lot of parents have about adjusting their kids is that we think of children as being so fragile, and I do agree they are fragile, and they're growing, and they need all the help that they can get. So when we adjust a child, for an infant, it's super easy. It's your 2 fingertips touching and maybe just a little bit more pressure on there is all it takes to adjust an infant. By the time they're getting close to 1 year old, you can see the little girl in the picture there. I actually lay them on the table just because they're squirming and they're all over the place, so I can lay them on the table. But still, it's so easy, it's very gentle. And most of the time, once a child has been adjusted 2 or 3 or 4 times, they run onto the table, they want to be first, and they're so excited to get adjusted. So for us, there's no limits on chiropractic. There's no age limits. There's no, you're too young, you're too old, you're too healthy, you're too unhealthy. We just want to check your spine, look for subluxation. If we find the subluxation, then we're going to adjust it. Another common question, how often should I come? The best way that I can explain it is using exercise as an example. With exercise, you kind of start slow and you kind of work your way up. Chiropractic's kind of the other way around. A lot of times your health is down here and you want it to be here. And so a lot of times in the beginning, I'll actually see you more often in the beginning. But as your health gets better, then we can kind of start to taper off a little bit, and then we hit kind of the maintenance point of where we keep adjusting you after that. And so a lot of times in the beginning we do see you a little bit more often, but as your health gets better, we see you a little bit less. And sometimes people waited a long time to get adjusted for the first time, or maybe they got adjusted 10, 20 years ago. That's still 10, 20 years of subluxation and what it can do to you. How long do I come? Another one of those famous things that people tell chiropractors, oh, once you go to the chiropractor, you got to keep going. They just want you to keep coming back. And so when people say things like that, I just remind them about their teeth. Do you get a cavity and then start brushing your teeth, or do you keep brushing your teeth to avoid the cavity? Of course, everyone knows you brush your teeth twice a day, you floss, you get your teeth checked twice a year. Chiropractic-wise, the concept's the same, it's just that we need to check your spine a little bit more often than twice a year. So yes, we do want you to continue to get adjusted, but if you never understand why, if you don't know why someone would keep getting their spine checked, then it doesn't make sense. And that's where we try to get people to get away from back pain chiropractic, and to try to get away from, only go in when my back's hurting type of thing, because we know research-wise, I've shown you with some of just a few slides and a few studies of how important it is to get your spine checked every so often. I can give lots of examples of that. Everyone knows you change the oil every 3,000 miles on your car, and you do that because the car will last better and it runs better, all those kinds of things. You don't wait for the red light to come on to change the oil. Our mission at Pomeroy Chiropractic Wellness is simply this. Chiropractic is the science of locating and the art of correcting subluxations without the use of drugs or surgery, and the philosophy that the body can heal itself when the nerve system is functioning properly. We do not treat pain, nor do we diagnose disease here. We detect and correct subluxations to keep you, your family, and our community healthy. For us, that's what we do. I love being a chiropractor. I love talking with patients. I love adjusting patients. I love giving them tips on diet and exercise and all those kinds of things. I don't claim to be a nutritionist, and I'm not an exercise physiologist, but I do like to discuss those things. So if you ever have questions, please let me know. So how can you help us fulfill our mission? We have these little stars up around the office, and then the RYF just stands for Refer Your Friends and Family. We don't do any marketing. We just based on new patients are simply almost all from referral. So hopefully somewhere down the road, you'll be like, hey, my chiropractor is a good guy. He does this cool class, and he takes good care of me, and maybe he can help your family as well. So hopefully someday you can pass the word along about Pomeroy Chiropractic. I would appreciate that. So I just want to thank you for your time, for watching the video. All you need to do now is call our office, Pomeroy Chiropractic. The phone number is 316-686-2020, 316-686-2020. You'll just call the office, make your appointment for your new patient visit, and we'll get started from there.